Hello, my name is Ozlem Ergun. I'm a professor of mechanical and industrial engineering at Northeastern University. My research focuses on design and management of large-scale and decentralized networks. I have applied my work on network design, management, and resilience to problems arising in many critical systems, including transportation, pharmaceuticals, and healthcare. I also work with organizations around the world that respond to emergencies and humanitarian crises. Some of these organizations include the United Nations World Food Programme, International Federation of Red Cross and Red Crescent Societies, FEMA, Army Corps of Engineers, and CDC. At Georgia Tech, I co-founded and co-directed the Health and Humanitarian Systems Research Center at the Supply Chain and Logistics Institute. Today, I will be talking about resilient systems. And resilient systems are equipped to respond effectively and recover quickly from disruptive events. A system can be broadly defined as a collection of interacting stakeholders, infrastructures, operations, and tasks that collectively form a complex whole. So some of the examples of systems that I work on include supply chains, transportation, manufacturing, energy, and healthcare infrastructures. Resiliency in systems can be achieved by making effective decisions in designing for and preparing, responding, and recovering from natural or man-made disruptive events. Effective decision-making in these strategies require the consideration of multiple issues. These issues include how to detect events that will eventually lead to a significant disruption, analyzing the trade-off between vulnerability and risk reduction to costs involved, understanding and managing the interaction and potentially conflicting objectives of many multiple stakeholders, and finally, allocation of limited resources under constrained settings. Today, as a case study, I will be discussing the growing epidemic of drug shortages in the US, which points to the fragility of pharmaceutical supply chains in the face of disruptions. Over the last decade, there has been an epidemic of drug shortage affecting the United States. Between 2008 and 2014, there was almost a 400% increase in shortages for direct life-saving emergency medicines. More recently, in 2017 and 18, there have been multiple drug shortages for sterile, injectable products that are endangering the lives of patients across the country, leading directly to canceled heart surgeries and chemotherapy treatments. The underlying causes of the most recent shortages for saline and other products include manufacturing suspensions due to production challenges, and finally the physical impact of Hurricane Maria in Puerto Rico, a critical manufacturing site. While the recent shortages have been linked to large events, this is not the case for all shortages. The lack of anticipation of the scale of the 2015 shortages and failure to react quickly was due to it being driven by the combination of many small distributed recall events. Beyond the effects on morbidity and mortality, the drug shortage crisis poses a significant economic toll, as often the response to drug shortages by healthcare providers requires more expensive alternatives to be purchased and used, contributing to rising healthcare costs. For example, with chemotherapy drugs, the drugs in shortage are often sold by gray market distributors with as much as a 3,000% markup in price. And then, the alternatives can also cost up to 20 times more. Furthermore, each newly reported drug shortage can stretch on and continue to be in effect for subsequent years, demonstrating the lack of resiliency within drug delivery supply chains. So, we state the grand challenge as improving resiliency of interdependent multi-stakeholder pharmaceutical supply chains against a variety of disruptive events. It is clear from the recent trends that the drug shortage crisis is not improving within the United States. With the significant health and economic toll that these drug shortages are causing for the United States, there is a critical need to address the lack of resiliency and robustness in the pharmaceutical industry, and more specifically within the interdependent supply chains at the heart of this industry. The performance of these supply chains and the ability or the lack of ability to supply pharmaceutical products is driven by three main features. First, the structures and design of the supply chain network. Second, the behaviors and operational decision-making processes of the many stakeholders within the supply chain. And finally, the governance and information-driven policies in place to influence behaviors and structures of the supply chains and to predict shortages. With an interdisciplinary research team, we address these three major features driving the grand challenge. I'm looking forward to sharing more detail during my lecture. Thank you.